Hi, I'm Dr. Kevin Zorn, founder and director of BPH Canada. Here to talk again about the Contino system, and the question that's often asked to me, how easy is it to get started on Contino? And I think the answer I tell my patients is, as long as you can sign your name, you should be able to do this. And why is that? Well, you have good eyesight. I think as long as you can manipulate a pen, you can do the same gesturing as inserting a small silicone tablet within the urethra. So that's simple. Being able to hold the phallus, insert, really is the simple learning curve. What one has to do is simply, mycontino.com. It's a great website, Canadian site actually from Vancouver, and they have a great set of resources explaining about urinary incontinence, why and how Contino works, and even setting up a free consultation with their team, which they'll engage the patient to learn more about their issues. Is it urge incontinence, stress incontinence, making sure they're the right fit. And then from that point, setting over to certain physiotherapists or physicians like myself who offer Contino. And then at that visit, which can sometimes take 10 or 15 minutes, we just want to calibrate the size of the urethral hole. So kind of like many other body parts, there's different variations in size of urethra between patients. So we'll have to find out if it's a small urethra or a large urethra, and we have different sizers. So we use a small sizer, we'll insert that under lubrication, find out what your French size is. So I did a patient the other day, he was a 27 French. So that's probably the secure fit. And some people think, well, is there some discomfort? There's some getting used to the product. So we'll actually bring them down 2 or 3 sizes, and then gradually over the next few weeks allow them to get used to that, using it progressively bigger sizes, starting 2 or 3 sizes down, and then using it prolonged periods of time to get up to that right spot. Kind of like patients learning to do insulin, using contact lenses. There's a learning curve. But at the end of the day, it's as simple as going on the website. If we're able to do your hand signature, you should be able to do Contino. So very little learning curve, very cost effective, very impactful for restoring continence, improving quality of life, and the long term, who really wants to be using pads and diapers. So if you're in that situation, go to mycontino.com, learn more about that, come visit us at our office. I'd be happy to consult with you and offer you what I think is the latest cutting edge innovative technology for stress incontinence.